Good evening, ladies and hopefully gentlemen. My name's Nina Lemtier, and this is our sixth session of Unveiling the Unseen Struggles of Women with Womb Conditions. Welcome, welcome, welcome. Just going to, hey James, thank you for joining. This should be really good for you to support any women that you might know with any womb conditions, because it's so particularly men to be aware so that they can support and ask the right questions. The lovely Alero should be joining us now. Thank you. Hi Alero.
Hello. Good evening, everyone.
Great. So we're really excited about delivering this session because we've had such a busy few weeks doing various different events. We've just completed our holistic empowerment workshop, which was a huge success, based on the feedback. I'm not just saying that. And
Yeah.
also Alera's been attending charitable events around empowering women's rights, women's menstrual health, and all the things that really surround what should be a given, what should be a standard expectation. But unfortunately, it's something we've had to been kind of demanding for over the years. So I think we'll do something slightly different. Let Alero maybe share briefly on her experience with the UN Women and her charitable events, and how that really impacts the new generation of women and women who are looking to empower their womb health, in all parameters, really.
Okay. Thank you for that, Nina. Good evening, everyone. So with the UN Women CSW going on at the moment, my the sessions I'm joining in has to do with reproductive health, women's health, and the policies that are being put in place, especially in England and United Kingdom, to help with diagnosis, to ensure that the delays are less. And it's so amazing to see so many women, so many, even very young ones, some in university, fighting and working towards achieving these goals. And it's not just in the United Kingdom; it's the entire world, really. The women, wanting to be heard, to be seen, and you know, we want a better life, better health for the women all over the world. And also with the events I've been around with, it's also been amazing seeing that it's not just women now; that we have men also wanting to support and wanting to know, what's happening, to be able to support the women in their lives, their daughters. Even with our event, if you remember, we had a father come with his daughter. It was really amazing to hear what he had to say, and this just got me thinking. We need more men in the room, and when we do our events, always saying, women only, it's kind of restricting them from also hearing from us and learning, what it is we're trying to learn for ourselves, because they can also support us. We some of us live alone, and some people have their husbands or brothers or partners with them, and they need to know how to support you in the best way. So yes, we need to learn and educate ourselves together. That's what I've learned from everything we've so far from the events I've been to through the week.
Great. Yeah, absolutely. Thank you for sharing. It's important because it's this kind of consistent message that women are hearing when they're telling, whether it's their boss or a friend, about their pains. Maybe it's
Yes,
period pain, it's just being shrugged off as, oh, it's just a
just
period.
normal. Yes.
It's normal,
Mm.
and this is actually contributing to the persistence and then the development of further conditions down the line that get really, really complex, you know.
Yeah.
So it's really important to keep raising awareness, and women sharing, you know, their
Story.
stories, and just letting all women know that it's not normal, and
It's not
any pain that is out of your range of what is you're accustomed to, you know your body more than anybody
anybody.
else. Make sure you're heard. Keep you know, ringing your doctor, pushing for scans, pushing to be heard, because do not accept painkillers and, oh, it's just a period kind of thing. You know, don't accept that.
Yes,
So
and
we
sorry, quick
really,
one. I just wanted to say, add something quickly.
yeah,
Also, never ever feel that the question you want to ask is stupid. No question is stupid. I mean, we've seen people recently, you know, every time we have an event or when the gathering a community of women, we hear someone say, I've never heard about fibroids before. I've never heard the word adenomyosis or endometriosis before. What are they? But some people feel embarrassed to ask because they feel, oh, everyone's talking about it, you know, just talking in different sections and like, oh, okay, let me keep quiet. No, don't keep quiet. Ask a question. No matter how silly you feel the question is, always ask. Please ask. Don't stay quiet.
absolutely, absolutely, because that's, you know, if you don't ask,
You
you
don't
won't
know.
get
Mm,
exposure. And then there's always someone else in the room, there's always someone that is happy that that person asked the question, because,
yes.
you know, they were doing what you're saying, they were
Mm,
hesitant to ask the
mm,
question. So
mm.
yeah, absolutely. Ask your doctor's questions, ask your gynecologist questions, always come prepared. And if you don't have um, a line of questions that you're comfortable with or you're confident with, then just seek guidance. You know, I've got a list of questions that I give out. So if you want that, just drop me a message. I'm sure Alero's got resources as
Yeah.
well. It's always good to come with questions written down, because often in the moment, particularly if you're told something that affects your emotions, that, you know, gets you feeling a bit uneasy, you're likely to forget what you
What
were
you
planning to ask. So coming with something written down that you can refer to. Not many doctors or consultants like to be videoed or recorded, so, you know, writing it down is, I'm sure, is absolutely fine.
yeah.
So that's a good tip.
Mm.
So we wanted to answer questions. So if you do have questions, feel free to put them, you know, to comment. Otherwise, whilst you're putting your questions together, we were going to kind of talk around some current um, media exposures that we've come across. You may have come across them, you may not have. One article that I recently came across that I wasn't aware of was actually sourced from The Sun. And it was really just the concept of chronic pelvic pain that a lot of women face. You know, it can mean that they're not able to work, they're not able to do their usual day-to-day activities, and they're not being kind of compensated for this. So there's no, it's very difficult to be for it to be recognized, so that there's a way of getting a level of insurance and kind of monetary compensation. So financially, it can be really of a struggle as well when it comes
Yeah.
to this, and it's caused by either endometriosis, fibroids, adenomyosis, which Alera's just mentioned, pelvic congestion syndrome, which is PCS, and also pelvic inflammatory disease, PID. And the pelvic inflammatory disease is more of a risk, particularly if you're infected with an STI. And it leads to infertility if it's not treated early enough. So in early intervention with anything that's abnormal, regular checks, you know, is so critical. It really is critical. So get yourself checked regularly. Anything out of the ordinary with your body, make sure you get it all checked out, because this has noted that it affects 1 in 8 women. So the chronic pelvic pain. And it really creates many challenges. And because of the long waiting lists on the NHS particularly, it's exacerbating the situation. So really just finding ways to support your body naturally as much as possible. Holistic ways. Look at, if you can look at your diet, your lifestyle, see how you can help yourself. This will be an important step, particularly if you are on a waiting list to see a gynecologist. I thought I saw a question, but I didn't. Elara, did you want to share anything on that?
Um, you said everything really. So basically, it's just everything you said about the pelvic pain, because people just take it for granted sometimes that it's just normal, and they try to just take painkillers and pain reliefs to just manage themselves, especially in the work environment, because they don't want to take time off work, or they feel, oh, it's normal, it's okay, which is not okay really. And you know, um, like you said, with the PID, the infection, if not checked on time, checked early, and treatment begins. If it's not done on time, it causes infertility. Sadly, a lot of women are falling into that category because they didn't realize that was what they had. So this is why we always say people to, run their tests from time to time, and also, get all your tests done, your smears. Don't ignore these things. The little things go a long way eventually. So we have to avoid anything that would, delay our treatments. If you notice any little thing, please check. Please check. Yeah.
Yeah, absolutely. And Dr. Sophie Strong, who's a consultant gynecologist, emphasizing any unusual pain, you have to get it checked. So
Timely. Yeah.
anything. So if your
Yes.
doctor is telling you anything else, one of my clients was saying that her doctor kept telling her to pray. He kept telling her because he
A
didn't want to
doctor.
give her a referral. Yeah, the doctor was telling her to pray about it.
My
And
goodness.
she, yeah. Can you believe that? And he kept doing it because she later realized that he was just avoiding giving her a referral. So referrals, apparently it's like gold dust.
Yeah.
It's to get a referral is you really have to kind of exhibit
The
very
life and death
yes,
situation. Sadly.
exactly. Yeah. So um remember that sometimes you might have to exaggerate.
Mm,
You might, this is the reality. If you
exactly.
go, you look like you can handle it, they won't give you a
Yeah.
referral.
Especially when you don't look like what you're talking about.
Yes, exactly. So if the gynecologist Sophie Strong is saying that seeking timely um, care is essential, that's what
Mm,
we need to be doing, ladies. So yeah, definitely seek for a specialist,
yeah.
because we often forget that the GPs are general practitioners. They're not specialists, so they're just there to give us a general kind of
General.
response,
Yes.
and we do often have to speak to a specialist. So yeah.
So if you're not getting the right answers, or right, they're not telling you the things you want to hear or referring you, please ask to be sent to a specialist,
Yeah,
a
absolutely.
women's health specialist. Yes.
So I will go ahead and answer a question that was sent in earlier
Yeah.
on how to actually tackle pelvic
Okay.
pain. We can do day to day to really help ourselves to reduce the impact. And one thing I found on my journey, particularly, was supplements, herbal teas, and movement. When you're taking the right supplement combination, it really significantly supports your blood circulation as well. And this eases the areas where there could be congestion, inflammation. And you find that when you combine that with regular movement, it makes a huge difference to your pain kind of threshold.
Mm.
So is really helpful. So if you don't, just taking supplements generally and kind of like, oh, I'll take it today, or I won't take it today, tomorrow, is not what you want. You want a proper plan that when you actually follow, you notice a difference. You can actually notice a difference in your energy levels, your mood, how you're approaching everyday tasks, etc. So make sure you've got a plan and not just, going kind of sporadically at it. So that's a key step. And also using castor oil packs. This is a great way, again, to promote circulation, particularly inflammation as well. It helps
Inflammation.
that. Sorry, Alera?
No, I said inflammation. It
Yeah,
helps with
exactly.
inflammation.
Yeah, yeah. So that's definitely a really great way to go, and doing it regularly, making it a nice kind of experience, maybe a hot bath with some magnesium. If that's saying I have a set times for my supplements, that's really, really, really good. Yeah, thank you for sharing that. And also practicing pelvic floor exercises. This is good as well. Always start with a set structure so that you can over time increase the intensity. This way you can actually see how you're progressing. And you can also obviously notice how you're getting stronger as well. And then you avoid kind of overly doing something. So, like if you don't really do something or exercise and then you're suddenly doing really advanced moves,
Yeah.
that cause a level of discomfort that will make you feel like this is not for me, or you might be a bit worried. But if you
Yeah.
start in a gentle way and kind of expose your body gradually over time, you find that it's enjoyable. You get the kind of feeling of I've done something, but it's not too uncomfortable. And that way you can really assess your progress. So always start low and then increase your intensity, over time. Yeah, that's really important. And if you also if you've not got a diet structure as well, that is again designed to optimize how frequently you're doing a number two, you're really passing out the toxins, because essentially the waste that our body produces needs to come out of our body very regularly. Okay, so your diet plan needs to really optimize that, because that will also support your hormones as well. So make sure that whatever you're eating, it allows your body, it supports that that movement, making sure everything's going in the direction it should go and there's no kind of stagnation. Because when you've got stagnation, it will impact how you feel. You'll feel lethargic, you'll feel heavy, you'll feel like you don't really want to do much. And again, inflammation creeps in because things are staying in places for too long. Areas are having pressure that they shouldn't have. So it just causes and exacerbates the issue. Okay, but if you can have a plan that will optimize your diet, like an anti-inflammatory approach, then what you'll find is when you do deviate, your body will speak to you, your body will communicate with you, and very quickly you realize, oh, I shouldn't have eaten that. And you're kind of, you're back to your plan, which is a good place to be, where you can really get your body's signals. Because if we ignore them, eventually it just adjusts, and before you know it, you're not getting those warning signals anymore. Your body, and you continue on your way until a later issue comes up, and we don't want it to get to that point. You really want to be connected with your body, your healing signs, any kind of signs that are uncomfortable, etc. So yeah, definitely follow those steps in regards to reducing pelvic pain. Okay, any questions that you received today, Alero?
Yes. So it's totally different from that one. I know someone has already asked about the Ryko. I know I heard a different pronunciation yesterday at the Guidance with event. I think the doctor called it Raiku or something. And I was like, oh, I know it is Ryko. It's going to be hard to change that now. So someone wanted to know, what's the question now? How it's used, how is Ryco used, and what's the main purpose of Ryco? Is it just for endometriosis? So when Ryco came out, the first time I heard about Ryco last year was for fibroids. It was being used for fibroids to help with the bleeding, and now it's been in. They're already using it in Scotland and in I think America is using it as well, but it's just been approved in the NHS England, with NHS England, for it to be used for endometriosis. So it's also used for fibroids, not just for endo. So it's for both of them. And at the moment, we're hearing good and bad. Some people have used it and the outcome is terrible. And some people have used it, and I think someone was saying she's used it for like 6 months, and she's okay with it. She's happy with it for fibroids. Um, Ryco is Ryeqo.
Yeah.
So the full name, let me see, the generic name is called Relugolix estradiol nortestosterone acetate. Well, we have to bite our tongue a little bit. So Ryco is the easiest one to call it. So once you type Ryeqo, it would give you the full generic name. So I think they said there's two types, Regulix and the other one. I can't remember what it's called now. But yes, but it's taken once a day as a tablet in tablet form, and the treatment should start within 5 days of your menstrual period. Patients should use non-hormonal contraceptions for at least 1 month after stopping Ryco. If you decide you want to stop it, if you decide it's not working for you or you're not feeling comfortable, you need to speak with your doctor. You can't stop it just like instantly to say, oh, I don't like how it's making me feel. Speak with your doctor about it, because when you're on Ryco, it's almost like taking contraceptives kind of, because you don't have, it stops your ovulation and all of that, and then stops your period over time. So you need to speak with your doctor, let your doctor explain or understand what's happening with you, so they can know the next step to take. So, but for what I've read from the researches I've seen, it's more like they take you off it and place you on contraceptives. Now you have to understand your body as well. They need to know what your body needs. Some people don't need progesterone. There's some people need extra progesterone. So you need to know what contraceptive you're going to be put onto when you're going off it, because your body needs to go clear of these things slowly. You just don't cut it out immediately. Like I said, who should take it? Women. Ryco is for women of reproductive age, and also you have to know if you're wanting to have kids. You know, speak to your doctor, know what you want, what your plan is at the age you're at before you decide you want to take it. And there's some patients with a history of depression should be monitored carefully if they decide to be on Ryco, because it's not really, it's still a new medication. So everything is being learned in the process. So they can't really guarantee everything. But yes, so yeah, if you have a history of depression, speak to your doctor about that before agreeing to have Ryco taken. Yes, that's all regarding Ryco that I have. Those are the questions I was asked. Yeah.
Great. Yeah, no, thanks for sharing that. And you touched on a really good point in regards to deciding that it's not for you, because and what steps you should actually do.
Yeah.
Because I've spoken with that are they're given a course of treatment and then not take, they just decide. They just, they just say, I'm not taking it, I've decided. It's important to get guidance on that and go to your doctor and explain how you feel, so that if there is a plan, a transition plan for that particular medication, you can go through that. Not to the body.
Not just stop that.
Yeah.
Yes.
Yeah. So it's important to not just stop anything. Get the guidance from your doctor or gynecologist. Yeah. Thank you.
You're welcome.
I think we had a question from Ifat.
Yes, Ifat. That's the spelling, Ryco. Yes, that's it.
Yeah. What sort of pelvic exercises would you recommend? There's quite a few. I can send you some so you can actually see visually. It'll be a bit difficult to show you now. However, one thing is really important is to do what you're comfortable with. So try a few, see what's comfortable, and then kind of have your selection and build on that. Anything that feels uncomfortable straight away, then just honor that and maybe try a different exercise. But yeah, I'll send you some guidance on that. If that, just curious, are you currently following any exercise plans specifically for the pelvic area? If that, okay, yeah, you've answered that. Hi, Ola. How do we ensure we are not going above our daily intake of supplements amidst what we eat? That's a good,
That's a good question.
yeah. So, in all honesty, a lot of what we take is not even
And
absorbed. Ola, that's what a lot of women don't realize, and that's why it's important to support your body with your diet. And diet should be first, because when your diet is supporting your body, then what you find is anything you're taking is absorbed by your body much more efficiently. So obviously there's nutrition in our food already, so when your body is more optimized, your body's able to absorb the nutrition from your food. And that's why supplements should just be that, just supplement what you're doing with your diet, right? So your main focus should be your diet, because that will improve everything. When it comes to taking supplements, you need to kind of look at your activity levels. You know, days that you're more active, you naturally have more water intake. And then obviously you can have supplements that will be more in line with a more active day. So really seek guidance from, you know, someone that will give you a plan that they're obviously experienced in, and then make sure you're listening to your body and just taking the supplements at the right times, because your body will take what it needs and flush everything out anyway. So it's very difficult to overdose. So to answer your question, it's difficult to take too much. But obviously you can you can still take too much, so always go with the guidelines of the supplements. But yeah, it's quite difficult, but your main focus should be your diet. Yeah, make sure your diet is really, really colorful. You're eating more whole foods, more nourishing foods, avoiding too much foods that are gonna really cause a level of inflammation, in all honesty. So lots of red meat, because it takes time for the body to digest, a lot of work, and it tends to stay in the body for quite a long time. So things like that, and just eat more vegetables, fiber, you know, drink lots of water, and you find that things tick over really naturally, and you don't even need that many supplements. But just seek guidance, I would say, Ola. And it's very difficult to overdose on supplements. Okay, not following any specific pelvic exercises. Okay, yeah, I do a couple when I'm at the gym, and I find that I'm definitely noticing my core is a lot stronger, and yeah, I find it quite relaxing. So stretches as well are really good, really nice pelvic stretches. I'll send you some guidance. Abby is asking, hi, I have a mummy pouch from childbirth. I've been trying to eat clean and doing exercises to strengthen my core. The gap is closing up, but my belly is still there. What else can I do? Okay, Abby, thanks for that question and sharing that as well. So would you say you can kind of pinch a lot of fat? If the answer is yes, then you also are likely to have quite a high level of toxins build up, which is not exclusive to just you. It's just something that happens over time. There are detoxes you can do that will target water retention and toxin also carrying water weight, and it can be quite stubborn. So I think you would definitely benefit from that as well. So if you drop me a message, I can send you some more information. But there is a lot that you can do just to support all the diet changes and the lifestyle changes you're making as well, to just get rid of that stubborn midsection area. And as we all get older, it's a section that
I know.
it becomes the most challenging. So yeah, you're not the only one. Thank you for that question.
Thank you, Abby.
And also, if you look at, do you have a morning routine, Abby? Do you have a specific kind of morning routine that it helps your body eliminate waste? Just curious if you do. And what's your breakfast looking like as well? I'll be curious to know. Just gonna check. Okay. In regards to, sorry, go on.
So I was going to say there's another question. There's one more. I have two questions. There's one more question, and person was asking, what is the most successful treatment for endometriosis? I had to look this up to be sure before I say this. So it's laparoscopy. So the laparoscopy is the one, the keyhole surgery. You don't have to be cut open. You don't have to go through the myomectomy. So it's the most common surgery that is used for, by the doctors to treat endometriosis. So that's the most successful treatment for endometriosis at the moment.
Okay.
That's if you're planning to have a surgery, you're wondering which one you want to. Most of the times you can't actually say this is what I want. It depends on what your MRIs or your scans are showing. That's what will determine what kind of surgery you're going to be having. Sometimes when you're going in, they tell you, oh, we're going to have a laparoscopy, but we might have to have a myomectomy. They might have to cut you open. So it depends on what's going on in there. So it's not a decision we can make as a patient, really. It depends on what is involved in getting your treatment.
Wow. And I've never heard of a myomectomy being done for endometriosis. Is that possible then?
Yeah.
Oh, okay. Wow.
We also have myomectomy for adenomyosis. So there's adenomyomectomy. Yes. There's adenomyomectomy. So it's literally the way you do for fibroids, but it's done to the to adenomyosis. But when it's diffused, because if it's everywhere, they can't do it because that's too risky. So yeah, well, yes.
Okay.
When it's an adenomyoma, because the adenomyoma is just a lump in one place, isn't it? So that sort of thing can be used for.
Right.
Yes.
Right.
But it's not very popular because of the way the treatment is. It's not like when you have, open myomectomy for fibroids. It's totally, yeah. I think it's more riskier, I guess. So yeah, but there is adenomyomectomy, and they do that as well for endo if or when they need to or they have to cut it open, then they have to have that done.
Right. Right. And do you know anyone personally that has had any open cut to remove endometriosis or adenoma, or do you know anyone?
From the research I was reading, there are quite a number of people that have done it. So it's not like it's not been done. So I've also listened to a few doctors talk about it. So yes, the people that have done it, yes.
The reason why I asked was
Because
because with the
even when I was having my my surgery done, my hysterectomy done. So my hysterectomy was done alongside with my excision of my bowel endometriosis.
right,
And they did mention to me, because when when you sign your what's that word now?
disclaimer contract.
Yes. The one you sign before you go in, when you do your
What is
assessment.
it?
I can't remember the word it's called again. So when you're signing that, it's to say just in case there's anything that happens.
Yeah.
So they did mention to me that they could also cut me open if it be. Yeah, but they didn't have to.
Right,
So
right. Okay. Yeah. The reason why I asked if you knew anyone like that's had it is because I know with the clients that I've spoken with that have developed endometriosis after whether it was a less invasive procedure, the laparoscopic
yeah.
way, they developed the endometriosis from that procedure. So yeah. So that
So
they didn't have any.
so what did they have that made them have a laparoscopy done?
So they've the fibroids removed, scraped out through that procedure, and then the endo developed after that.
So it wasn't like they did a biopsy and told them they had endo.
Well, they could see it from the MRI
Before the surgery or after the surgery?
after this. surgery. So the endo developed after the
So
surgery.
they didn't have it before.
No,
Wow.
no.
Wow.
And there was a lady that reached out to me on Instagram, actually. I've just forgotten her name. She's been quite public with her story. It was the
Okay.
same, had the myomectomy though, and then developed adenomyosis after the procedure, the myomectomy. Yeah. So that's why I asked if you knew someone that's had because it will be interesting to know what their experience in regards to
But it'd
recovery.
also be interesting to know if they actually had a full MRI done before their surgery to be certain that they didn't have it. Because sometimes some people don't know they have adenomyosis or endometriosis. It's when they have surgery that they find out that they actually have it after the surgery. So most times it's after surgery, some people are told, oh, after the surgery, we found out you had adenomyosis. So it could be there and you don't know. That's
Right.
another thing, because if you're
Yeah.
not, if you're not checking or searching for something, you're not going to know it's there. If you're saying you're treating fibroids and you're not checking for adenomyosis or endometriosis, so it might just be like it's not severe when she was having surgery, so she might not know because it won't show on your ultrasound. Endo won't show. It's
No,
possible for endo.
on ultrasounds, it's the MRI it will show, isn't it?
Yeah, MRI. Sometimes it
Yeah.
could not. Yeah, but definitely adenomyosis you can find on your
Right.
MRI. But
Right.
100% for you to be very certain about endo is through laparoscopy
Right.
as well.
Right.
Taking the biopsy and checking and all
Right.
of that.
Right. Right.
Yes.
Got you. Yeah. Yeah. One of my
Oh yes,
clients,
yes,
25.
Ola, consent form. Thank you.
Oh yeah.
Consent form. Yeah.
Right. And Abby, you take fruits breakfast daily. Are those, would you say, sugary fruits or what sort of fruits? Sorry. If they are not sugary fruits, then that's great. And just try and combine it with a protein. So maybe chia seeds. Just combine, because with your meals, you want to make sure you're trying to have the protein and complex carbs as well. So fruits is great, but it's even better if you combine it with protein and some, yeah. Hi, Andia. Hey, ladies, thanks for joining. Oh, we've got like 12 people, ladies on, which is great. Okay, so we are taking questions. If you do have any. Thank you for the questions that we've had so far.
Yeah. Thank you, ladies. Do you have any questions, Nina? I think I only had two questions.
Okay, let me check. Yeah, that was the only one I've got. Um, what I also wanted to just run over in regards to well, Alera and I were talking today in regards to kind of the concept of, you know, curing anything, you
You
know,
have anything?
and
Yes.
you know, if you hear that, okay, I've got a cure for something, it may not be wound conditions, it could be anything, you know, it can be quite, it's a sensitive area because obviously making medical claims is not, you know, it's an area that you have to be very careful with. So if you ever hear anything like that, just apply due diligence and know that anything that is promising quick, very quick results with,
In regards to your health.
yeah, in regards to your health is probably, yeah, you know, you've just got to apply due diligence and know that when treating, particularly my perspective is a holistic approach and really making it a lifestyle and really deciding to connect with your body more. That's what I promote. And I think it's a win-win whether you're on a treatment plan, an active treatment plan with your doctor or consultant or not. There's nothing stopping you from supporting your body, you know, naturally reconnecting with your body, being able to identify when you have something that doesn't agree with you, you know, that can only be a plus, you know.
Yeah.
So that's what we really, really advocate for, and really, I can't repeat enough the power the body has, you know, our natural healing capabilities, but often because of direct ways that we kind of obviously have to exist in this world today, our body gets bombarded, you know, with lots of different things that cause a lot of complexities, and that's what we're essentially navigating, you know, day to day. But you can get better, you can see significant improvements in symptoms, and in your actual conditions when you support the body in the right way. I've experienced that myself time and time again with my clients. Alera as well, you know, she saw a huge, you know, once you started,
Yeah.
you said, make adjustments with your lifestyle
Yeah.
and your diet. You saw that the pain wasn't as, you know, as bad. So
Yes.
yeah, never give up on that. Never give up on that. And of course, we all need medicine. We all need doctors and consultants, but obviously they're advising us within their capacity, which is always kind of time. There's time constraints, there's resources constraints, and they tend to want to see you, they need to see you at a certain level of severity, in all honesty, before they're going to escalate with a referral. So the reality is, you have to help yourself. You have to take responsibility, you know,
Yeah.
over your health and what's going on to a high degree, so that you can win and you know, and really progress in the right direction in regards to your family goals, your fertility goals, your wellness goals, whatever they are, you know. Miss Amusu is asking, okay, hi Nina, how should I balance my hormones? Too much estrogen. Okay, so this is it's a great question, but it's such a wide range
Right.
of, in all honesty, because so many variables impact our hormones. Literally, you know, it could be products that you're using topically that is impacting your hormones. It can be what you're ingesting through um, items that are mimicking estrogen in the body, you know, and they come in the form of kind of plastics, chemicals. So this is giving your body signs that there's estrogen and it's not even, you know, so there's so many things. So it's really just having to peel back the layers in regards to what your diet looks like, what you're exposing yourself to, you know, your lifestyle, how often you're doing a number two, which is a bit, but all these factors will impact the estrogen. So if your estrogen is high, address your diet, what you're using topically on your skin, address your cleaning products, the rate at which you are kind of detoxing. So how often do you get into a really good sweat, your exercise frequency, um, even your sleep. Your sleep is really, really critical as well.
Yeah.
Quality of your sleep. So it's not really the number of hours, it's the depth of sleep. You're going into, want to get into kind of stage 4 sleep. So this is where your body really gets to regenerate, your hormones get to really balance out. And so it's a wide area, but you can start, you know, with the basics. Okay, and just monitor how you feel. So journal as you
Yeah.
start this as well, for any changes, and get guidance from a health, you know, professional, so that they can also guide you with their expertise as well. So I hope that's helpful, Mrs. Amuzu. Thank you for your question.
Thank you.
If that's saying could be the liver is clogged up. Yeah, the liver is also a key part of detoxing, and detoxing the liver is a really key way. So looking again how to promote your liver health is a key step
Yeah.
as well. Stress also affects estrogen levels. Absolutely. Yeah.
Alcohol. If you're taking
Sorry.
alcohol. I said alcohol
Yeah,
can affect them. If you're drinking, that could be something you should look into.
yeah, yeah, definitely. So, Mrs. Amazu, just curious, would you say you've already started making changes? Where are you at on kind of approaching this in regards to managing reducing your estrogen levels? Andy is saying blood sugar levels too. Absolutely, yeah. So that will be linked in with the foods.
Yeah, the
Yeah,
foods you're having.
liquid. Thanks, Andy. I know you're such a pro now at what you're
Mhm.
doing. Thanks for all your contributions.
Thank you,
Um,
Andy. Yeah.
no
Mm.
total. Oh, is that a tea? Is that a brand of tea? Sorry, Alara, have I read that wrong?
No, I think
Or
it's what's it called now? Oh, it's not coming to me. Let me see. It's it's not a tea. It's English is going out of me. She's not taking alcohol. I
okay,
was going to book with GP for hormone test. That would be useful. He said I'm going to book with the GP for a hormone test. Yeah. Yeah. So
yeah.
being total is when you abstain from alcohol, no alcohol. Yeah.
Oh, okay, okay. You learn
Yeah.
something new every day.
Mm.
I'm so not. Thanks
It's
for clarifying.
too many things for us to learn.
Mm,
We learn every day. It's too many.
yeah. And how do you feel, Miss Amazu? How do you feel in yourself in regards to the hormones? Oh, and
Oh,
yeah, that's so
you're
lovely.
welcome, Andia.
Oh, you're welcome.
You're welcome.
Oh, that's great. I'm glad you find them helpful. Great. Okay. So, yeah, it would always be good to get a test because the test will always give you a level of clarity and help you, you know, make a plan and make changes. And if you want any guidance, feel free to DM me. I also offer tests, hormone tests as well, with plans and support. If that's saying progesterone rich foods would be good, absolutely. Yeah. Okay. All right. So if we don't have any other questions, we will we'll call it a day and look forward to our next session, which will be session 7 next month, and we'll
Amazing.
have lots to share with you. I know Alera's been doing lots of different things, um, and I'm going to be running a training for Brent
Brent.
Hansel. Um,
Yeah.
Brent, yeah. So that's an in-person training. So I'm planning for that. And it's really just, yeah, let's just continue to empower each other and share and know that you have the power. You
Yeah.
know, I always say, I'm probably quite annoying with this, but have a vision, check in with that vision every day.
Yeah.
When you wake up, before you go to sleep, what does your wellness look like? What does your work life look like? Your love life, your children, whatever. Have a vision, because if you see it in your mind, you can hold it with your hand, and the healing will start with your heart and your mind. It doesn't matter what the diagnosis is. I'm not saying it's easy. It's
Mm.
never easy to hear, you've got this, you've got that. But ultimately, if you can hold on to hope and hold on to your vision, that is healing in itself. That
That's
is
right.
healing. Okay, so don't let fear grip you. Don't
Yeah.
let this. You need a community. Alera's always saying this. I'm always saying this. Come into a community, reach out, have conversations, because this is where you'll draw strength. You're not alone, and you know that there's hope. There's always hope. And that you hear so many times doctors saying you can't have this, you can't be pregnant, you can't. And women having it, and they're proving, disproving these statements all the time. So please never give up hope, never give up on your body, never give up on your healing, never give up on your vision. Vision is everything. Okay, so thank you for joining, ladies. Thank you, Alero. It's always
Before you wrap up, I just want to say to everyone here, I know some of us weren't there, but we had our first live physical event, and I must confess, we had, give or take, 6 weeks, the first 6 weeks to come up with the name, and the other 4 weeks to put everything in place. And to the glory of God, we want to say that it was successful, and we're so glad we're able to impact lives. And everyone's asking, when is the next one? We didn't even think about having another one. It was just something to reach out to the community per se. And we're so, so thankful for everyone that took part and supported. And we'll definitely be planning another one. So yeah, if you know any woman out there, even a man that needs more information or anything, please just direct them to our lives, or give them our handles or email address or anything, so that they can reach out and learn more. And as women as well, there's so many communities out there. There's the guidance suite, there's the womb care, there's Adeno Gang, there's Gen Endometriosis, that so many people for different areas. So you just don't stay on your own and just say, you know what, let me come out here today. Oh, Moss and Glow. Yes, Moss and Glow is out there as well. And yeah, so you just don't just be quiet or say, I don't want to come out, or I don't think I know enough, and I don't feel I should be able to. When you come and, listen to other people speak and talk about what they're going through, it encourages you, and you hear how people getting better, how they've changed their diet. It's not easy, especially when you're doing it by yourself. You're not accountable to anyone. So you can decide, you know what, I can't do this anymore. And after 2 weeks of actually being serious with it, you just leave it and start eating anything and everything you want. So find someone who you can be accountable to. Find someone who's going to make you feel disciplined enough to carry out, these things. Like Miss Amuzu, I think that was your name. You need someone that you can say, oh, she's going to ask me now if I ate my breakfast properly, or if I had my 2 liters of water, just things like that. That's why you need to be in a community and get the support that you need. Don't stay quiet, ladies. Don't stay quiet.
Absolutely, absolutely. And getting the support comes with knowledge, and I realized when I started to ask questions and attend events early on in my nutrition kind of courses,
Area.
and I realized there was so much resources to support the body whilst embarking on these diet adjustments, because let's face it, it's not easy.
It's
you know
not. It's not.
to ignore the ice cream and ignore dessert,
I know. I
and
mean,
have
yesterday I was at the event with the guidance. We blessed them. That it was an amazing event, and I'm not trying to market or anything, but yeah, it's always lovely to be with them. And Tanya from Adino Gang was having coffee, and I sniffed the coffee. I haven't had coffee for so long. I was like, Tanya, you having coffee? She was like, yes. Why? And I went and got myself coffee, and I like, oh my God, I don't usually have coffee anymore, but yeah, I just say, you know what, it's allowed. It's cheat day. I'm not going to take it. I don't have any at home, so yes. Um, so these are the little things, because I know sometimes I'm talking to Nina, I'm going to feel guilty and say, you know what, I had coffee, or I had this or that. So you just need to be accountable to someone. Yeah.
absolutely. Yeah. So Abby's asking, can you recommend some communities? Yes, Abby. So we've got Alero has a community. What's your name of your
Fem Power Hub.
Fem Power Hub? We've got the womb care.
Womb
We've
care.
got the guidance suite, as Alero said. We've got
Adino
Adino Gang.
Gang. Yes.
So there's quite a few. And
So it depends on the area you're looking at and what you
yeah,
want.
yeah. We had our event in London, Woolwich, South East. I think a lot of the events tend to be
Yeah.
London.
Yeah.
Just send me a message and we can send you some free resources,
Yeah.
Abby, so you can start
Yeah.
actioning. and we've got an accountability session coming up soon, which is, you know, absolutely free.
It's
We're
going to
going
be
to be
amazing. Yes.
checking on each other. So drop either of us a message and we'll connect you with that. Oh, Nina's calls really help to keep us motivated. Yeah, I do.
Oh, bless you.
Yeah.
That's
Sorry,
what the accountability bit is about. My friend is looking to talk to you, ladies. Oh, hola, who's that? Who? Oh, Moss and Glow. Send her. Yeah, she can reach out. I'll speak to you. I'll speak to you about it. Thank you for that. Thank you so much for that.
Okay, thanks for joining, Abby.
Thank you, everyone. Thank you so much.
We'll see you
Hi.
next month.
All right. See you next month, third Sunday of April. Have a beautiful week and happy
Have a lovely
Mother's Day to everyone.
Bye.